and welcome. You're watching Health and Wellness Save a Life. I'm Gargi Rawat. One of the deadliest diseases is heart disease. Heart disease is the #1 cause of death in men and women worldwide. More people die from it each year than from all forms of cancer. Heart disease does not only occur in older adults, it also is affecting younger adults more and more. So what is more threatening? Heart disease can cause death instantly. The main reason for heart-related deaths is a lack of awareness of what to do in a cardiac emergency. Educating the public about signs of a heart attack and cardiac arrest and the importance of taking immediate action to improve survival can minimize the damage that can occur after a heart attack or cardiac arrest. People with heart disease are at higher risk. However, cardiac arrest can also occur without warning in people who appear healthy and have no known heart disease. Most cases of sudden cardiac arrest occur outside of hospitals. Now, most often happens in the home as well, and we can reduce the mortality rate through awareness and bystander intervention. Life-saving techniques such as cardiopulmonary resuscitation can give the opportunity to save a life. Save a Life is an initiative to make people aware of the early signs and symptoms of cardiac arrest. We have with us eminent cardiologists today who will help us understand sudden cardiac death and the role of CPR. We're joined by Dr. Arup Das Biswas, Professor and Head of Department Cardiology, Institute of Cardiovascular Sciences. We have Dr. Nitin Agarwal, Interventional Cardiologist, Sri Balaji Action Medical Institute, Namya Medical Heart Center, and Dr. Renju Kumar, BC Consultant Interventional Cardiologist, Renai Medicity, Kochi. Thank you so much, doctors, for joining us on the program. I'd like to start with you, Dr. Das Biswas. Cardiovascular diseases are a group of disorders that affect the heart and blood vessels. Which cardiovascular disease is the deadliest and why?
As you said, cardiovascular is the commonest cause of death globally and in India. Now, there could be various types of cardiovascular disease, but out of that, the deadliest one is coronary artery disease, and also this is the most frequent one. This is the commonest cause of death as well as sudden death. And coronary artery disease means affection of the arteries that supply the heart, particularly cholesterol deposits out of atherosclerosis. That can be a leading cause of death in all ages, particularly in the middle ages.
Right. Dr. Agarwal, what are some of the common risk factors associated with cardiac disease in general?
Thanks, Gargiji. First of all, good afternoon. What are the risk factors? Risk factors are the variables which predispose to cardiac conditions. There are two important risk factors. One are the non-modifiable, which we are born with, like race, heredity, age, sex, genetic factors. These cannot be modified. They cannot be changed or treated. But the modifiable risk factors, the second one, like high BP, cholesterol, smoking, obesity, alcohol consumption, sedentary lifestyle, obesity, and dyslipidemia. These are the factors which we can treat, which can be changed and modified. So our goal is to modify these risk factors to prevent coronary artery disease from occurring in the early stages.
Right, Dr. Renju Kumar, during cardiac arrest, now we all hear about cardiac arrest, but if you could explain to viewers what actually happens to a person, just what is a cardiac arrest?
Yeah, cardiac arrest actually it's a real medical emergency, and a quick action can save a life. That is the most important part of this cardiac arrest. So cardiac arrest occurs when the heart suddenly and unexpectedly stops pumping, so that the blood flow to the vital organs are stopped. Mainly affected organs are brain, kidney and liver. And if the blood flow stops to these organs within a few minutes, the patient can die. And the causes for this cardiac arrest is usually cardiac arrhythmias like ventricular tachycardia and ventricular fibrillation are one of the commonest causes. And heart disease like coronary heart disease is one of the more common cause of cardiac arrest. And during cardiac arrest, the patient become unresponsive, may lose consciousness and unable to breathe.
Right, Dr. Das Biswas, as we know, heart failure is when your heart is unable to pump blood, which is sufficient to meet your body's needs all the time. Can heart failure then lead to the sudden cardiac arrest?
Yes. Thank you for raising this issue. This is a very common problem. In fact, heart failure is increasing day by day, particularly in India. And people with heart failure are 6 to 9 times at the risk of developing VTVF that my colleague was explaining. And with this VTVF, this can be lethal and take away the patient's life. And this can happen in any stage of heart failure. And with the progression of heart failure, the types of death can change. However, this is one of the commonest cause of sudden death. And as I said, VTVF can be a cause, but at times it is slow rate and cardiac asystole, that is stoppage of cardiac rhythm, that may be a cause of sudden death also. So you said rightly, it is one of the common cause of sudden death.
Dr. Agarwal, a competitive lifestyle keeps this generation under constant stress. So can constant stress cause sudden cardiac death? Is that why we're hearing more and more such cases?
Thanks, Gargiji, for asking this very relevant question in present scenario. The answer to this question is big yes, because as we can see nowadays, many youngsters in the age of 30 to 40, 40 to 50, while doing exercises or having some stress, are succumbing to the cardiac diseases. Mental stress releases two lethal hormones, cortisol and epinephrine, which can increase our heart rate and BP, which have a detrimental effects on blood vessels as well as cardiac. It may lead to life-threatening arrhythmias, as told by my seniors, and can lead to sudden death. It can increase the heart rate and cause various rhythm abnormalities like AF, VF, PT, which can lead to sudden cardiac arrest. But on the contrary, when we are happy, when we are doing exercise, when we laugh, we release dopamine, serotonin, and endorphins, which are excitatory neurotransmitters, which are neuroinspirational transmitters, and performance hormones, which decreases our chance of getting succumb to cardiac diseases and have a positivity in our heart styles. So I must say the competitive lifestyle is the never to do again, because it can lead to mental stress as well as the cardiac arrhythmic problems.
Right. Dr. Renju Kumar, how can you help someone experiencing a heart attack or a sudden cardiac arrest, if you could tell our viewers?
Yeah, thank you, Gagiji, for this question. Actually, cardiac arrest and heart attack are two different conditions. And, the public thinks that the heart attack and cardiac arrest are same, but actually these are two conditions. But the prolonged heart attack can lead to a cardiac arrest. What happens during cardiac heart attack is that suddenly there is an occlusion of a coronary artery due to a blockage, and there is an occlusion of the vessel, so that the blood flow to the cardiac muscles will be lost, which will lead to heart attack. During heart attack, the patient experience severe centralized chest pain or chest discomfort, which can spread to either his back, shoulder, arms, jaws, or to the abdomen. Along with that, he may feel profuse sweating and breathlessness. If these signs are there for this patient, you should suspect that this patient has got a heart attack. If you witness a patient with a heart attack, immediate response should be you should look for a immediate medical attention, where you can get a medical emergency facility at the earliest. So you call for a help and try to mobilize the patient to that medical emergency. Meanwhile, if it is available, you can start the patient on blood thinners like aspirin and clopidogrel. And once you reach the medical facility, you take an ECG immediately and do some necessary blood tests to detect whether it is a heart attack. If you diagnose it as a heart attack, then you go for appropriate treatment protocol according to the type of heart attack. Whereas in cardiac arrest, if you witness a patient with cardiac arrest, first of all, you have to check whether the patient is breathing whether the patient has a pulse. If the patient is and make the patient lie on the flat floor, because the patient may suddenly fall and may injure his head, and such type of accidents can also happen. So once the patient doesn't have any breath or pulse, you immediately quickly start a CPR, and you call for a help from a second person if available, and start CPR according to the protocol.
All right, Dr. Das Biswas, if you could explain us what are some of the important points to remember when performing hands-only CPR, and what exactly, if you could explain, what is hands-only CPR?
That's fine. Actually, awareness among the common people is the way to salvage persons who are having arrest in the station, bus stop, railway stop, road, etc. Everybody will not be having it in the hospital. Out of hospital death is commoner. And that is why it is the important reason to spread awareness amongst the common people. Hands only means you focus mainly upon the pumping. That starts with making the patient lie on a firm ground, floor, or if he is on a bed and cannot be shifted on a floor, then a harder firm plank, like a wooden plank, should be placed under his back so that the CPR can be given. CPR doesn't mean cardiopulmonary resuscitation alone. It is also means cardiopulmonary cerebral resuscitation. That means brain should be having adequate blood flow, and for that one should ascertain first by shaking him, are you okay? Then asking for help from other people, putting your fingers on the carotid to check the pulse, check the breathing, and when the patient is firmly secure on a firm ground, then place your hands like this, one wrist upon other, and this hand, the heel of the hand, should be placed on the lower part of the sternum. That means the central breastbone, and there should be quick pressures on it. And at that time, the elbow should be straight like this, and the force should come from the shoulder, not from the elbow, so that the person who is rendering it is not fatigued. And at this phase, initially, mouth-to-mouth breathing was given a lot of importance, but in cardiac arrest, it has been seen the final focus of attention should be the circulation. And for that, the pumping is essential, and the pumping should be adequately spaced. So it should be about 100 to 120 per minute, or approximately 2 pumps a bit per second. And then you allow the chest to passively raise up, look that the chest is expanding, and the initial compression should be about 2 inches. However, this differs from person to person depending upon his age, chest configuration, etc. And it is best if a person is trained by training him on a mannequin so that he learns the procedure perfectly. Thank you so much.
All right. Thank you for that, Doctor. And with that, we'll slip into a short break and return with more questions for the doctors. Do stay with us.